Hi, my name is Sunny Snyder. It's June 27th, 2019. I'm going to discuss our first short video presentation. As we know, pathophysiology is the study of disease or abnormal processes, and all the subjects I will be referring to in the next few minutes are all closely related but different in the same way. It's important that we understand these because it is the basis of this class and pathophysiology in general. First, I'll be discussing the disease definition. This is the most basic way to describe the disease. For example, multiple sclerosis can be defined as damage to the nerve cells that affects the brain and the spine. Every disease has its own unique definition that allows the medical providers to treat the disease as best as they can. Next is disease classification. There's many different ways to classify a disease, and diseases can also fall into multiple categories. For example, there's anatomical classification, which is the organ and tissue of your body. It can be topical, where it's located. It can be physiological, which is by function. So the example I will talk about is heart disease, and which would fall under the anatomical because it's the tissue, it's the organ of your heart. And when you classify it like that, it allows the doctors to focus on what is specifically affecting the heart and lets you get more specialized treatment. The next topic is etiology. This is the cause or the manner of the disease, why you got the disease. This one's pretty simple to understand. A good example is why you get high blood pressure. So the cause of that could be from smoking or a poor diet, lack of exercise. This is important because if you know what's causing the disease, then hopefully you can take measures to prevent or decrease the progression of the disease. Next, excuse me. Next is pathogenesis, which is how the disease developed and came to be. So, for example, if you were to go to the doctor and say, I have the flu, they would run tests and see if it's something with genetics, something with a malfunction of a body part. They would run the tests and determine why you developed the flu. The next topic is symptoms. Symptoms is specifically unique because it is how the subject or the patient feels. It's a subjective feeling. It's usually the evidence of a disease or condition. So if I came to the doctor and said, I have a rash, I see my rash, I feel my rash, that is a symptom of hives or whatever condition you have. Symptoms and signs are usually confused with each other because the sign is what the doctor or the care provider feels and sees. It has to be objective and observed from them. So an example of this is if you came to the doctor and you didn't know you had swollen lymph nodes. Let's say you didn't know you had swollen lymph nodes, and they told you you have swollen lymph nodes. That's an example of a sign because you did not observe it, the provider did. Next is syndrome. So this is a combination of the signs and the symptoms observed that can classify as a syndrome. So for example, Down syndrome. That's an extra copy of the 21st chromosome. A person usually has many signs and symptoms at birth that determines that this is Down syndrome. Next is diagnosis. This is the identification of the illness. So if I were to come into the doctor with pressure in my bladder, frequency to urinate, they would diagnose me with a urinary tract infection. The next is complications, and this is usually a consequence of the disease. It's typically unforeseen and can prolong the getting better, prolong the curing of the disease. For example, if you were under anesthesia and you got hives or allergic reaction, that's a complication of the surgery. And lastly is diagnostic media. This is things they use to grow organisms, so they can determine which the species belongs to. It's actually really cool. They can grow the bacteria in there and make it specific to which, like the root of the issue. An example of this is used to ascertain the hemolytic activities of microbes. I had to read that because it was a mouthful. But it's important, diagnostic media is important because it allows for the most efficient cause of treatment and can really narrow down the issue.